Hi, I'm Dr. Bill Widener, and today we want to talk about what it looks like in the life of a new patient when they come in with hip pain. So when you first come in the office, you'll be seated in this beautiful lobby, and if you haven't done the paperwork already online, then the front desk will give you that paperwork and you'll be able to just briefly fill that in for us. And when you're done with that, case management will come over and they will escort you into the following room. You'll come across the lobby, and then you'll come into this beautiful setting, and case management will ask you some very important questions and listen to your story so that we can start the process of understanding what the underlying concerns and problems are. When you're done here, case management will then bring you into our first exam room. In here, you'll meet one of our providers, and they will start the process of understanding clinically what is the underlying cause of your condition. With that, we'll come down here, and you may be requested to come into this room. Here we have a diagnostic ultrasound. We have a number of different diagnostic tools in this office that can further allow us to understand what the underlying cause of your problem is. We'll then come down here, and you'll be guided into this room, and most likely, particularly with hip pain, we'll want to take some x-rays so that we can see exactly what's going on with that ball and socket joint. So you'll be here, you'll come into our imaging center, and then here we have digital x-ray that can clearly identify more of the problem with that hip pain. From there, once we understand more about what the actual cause of the problem is, then we can start to treat the problem. We have a number of different, very unique tools in our toolbox that allows for us to correct hip pain. These are some of our decompression tables. These decompression tables help us take pressure off of nerves that go into the hip. In addition to that, we have a laser department that allows us to use multiple lasers so that we can decrease inflammation, we can increase circulation and oxygen, we can help the joint itself repair. In addition, we then have a passive therapy room. In this environment, we've got a number of different technologies so that we can also add to the uniqueness of your problem by offering these services that help the patient feel better faster and also decrease that inflammation and also be able to get that range of motion back in the joint. As that tissue repair is happening, then we want to go into our active therapy department. This is where we do stretches and exercises. This is where we help the patient be able to package those changes. And then finally, we've got this is our kind of more of our structural correction. A lot of patients with hip pain have pelvic misalignment and distortion, which also causes that hip pain. So there's a quick tour of what a hip pain patient would be able to enjoy in our office. We look forward to personally giving you that tour, and we hope to see you soon. Thank you.